Over the years, I've had a number of patients ask me, Dr. Pete, why do we need to take x-rays? Can't you feel what's wrong? I know what's wrong, I can feel the muscles. Don't you know what you're doing? My old chiropractor, he never needed x-rays, and I hear comments like that fairly often, and I understand. But almost always, I know what we're going to find when I take the x-rays. I can usually predict if there's going to be arthritis, if there's going to be some spurs, if there's going to be degenerative discs, if there's going to be curvatures or lost normal curves, or if there's a pelvic rotation. These are the things that almost always I know in advance. In fact, Mayo Clinic once said that 95% of diagnostic work is done in the consultation. However, in 2 or 3% of the patients, we find something that we didn't expect. One example. The first year I was in practice, I had a 65-year-old lady come in, and she had back pain, and we took an x-ray. It wasn't necessary according to many people, but we took an x-ray. And we found in her abdomen a large aneurysm. As a matter of fact, that abdominal aneurysm measured 25 millimeters. We sent her to the surgeon for a consultation, and the surgeon said, that's not a problem, you can safely treat her. And we did, and she got better. 5 years later, she came back. We took an update x-ray, and that aneurysm had grown from 25 millimeters to 40 millimeters in 5 years. We sent her to the surgeon, he checked her out, and they immediately put her in and had surgery. And it saved her life. Why? Because of an x-ray. And I would never have known that that aneurysm was there without an x-ray. Also, I had a young male patient. He was 22 years old. Headaches and neck pain. He told me, Doc, I know it's just stress. And I insisted that we get x-rays anyway. And we did the x-rays. You know what we found? It was not stress. We found a spinal cord tumor which was causing the headaches. And if I would have assumed that this is just a 22-year-old kid, I don't have anything to worry about, and if we had begun chiropractic treatment, especially if we had done any manipulation of the cervical spine, I don't think it would have been a happy outcome. So because I've had the experience of some cases finding things that we had never expected, today, after 31 years, we take x-rays almost always. Not with everybody, but it is a rare exception. So when you're in our office, if we recommend x-rays, you can be sure I feel that there's a good clinical reason for that recommendation.